Let's recap a little bit on the assessment.
Yep.
And you can tell me what you found, and you can also tell me if there's anything else that you would do differently, or that you're not sure that you got the information that you want. So
Alright.
tell me what you found.
Yeah, so I found that Barry had a decreased muscle length in his gastrocs and soleus on his right side.
Yeah.
I also found that he did have a bit of a catch when I was testing spasticity. I think he may have had some increased tone on his right side in his gastrocs.
Right, okay, and you only looked at gastrocs.
I forgot to do soleus.
But that's okay.
So that would be something I would do next time.
Yeah. Whereabouts was the catch?
I would probably say it was almost in maybe I don't recall actually. I don't think I've sort of recorded that. Was it before neutral? I was going to say it's probably just before neutral.
Just before neutral?
Yeah, maybe.
So it could be significant then.
Yes.
In that case. Okay.
Yep.
All right. So we've got some decreased muscle length. We've got potentially some spasticity.
Yep.
What else?
Okay. So I don't know how well I did the sensation and the proprioception testing. I don't know whether there was a bit of confusion as to maybe the instructions on when he felt something and where he was feeling it, but I probably should have clarified that myself.
All right, so with the sensation testing, are you confident that he's got light touch? Can he feel light touch?
Yes, I think he can, yes.
Yep. Okay.
Although his responses were different and they were the wrong leg, but I don't know whether that was just a confusion.
Yep, so, okay, I see what you mean. So you don't know whether or not he can tell which leg he's feeling, or whether it was something to do with his speech or being confused.
Yeah, it could possibly be any of those. Yep, all
Yep.
of the above really, so yep.
Yep, okay.
And I think with proprioception as well, it was a bit difficult because he does have that like extreme external rotation on the right side. I know he wasn't really matching up what I was doing, but again, I don't know whether that's contributed to the fact that his strength is reduced.
And I think I think that you probably could have just slowed down with that, and you could have either given him more opportunity to get his leg back to neutral and then start again, or alternatively you could have placed his right leg and asked him to mirror with his left leg.
Okay, yep.
You could have done that, or you could have done joint position sense, where you could have, taken his ankle and got him to shut his eyes and tell you if it's up or down.
Yep, sure. Yep, actually, that's what I would normally do, but I didn't remember to do it that time.
Even bearing all that in mind, though, you know that with proprioception, a great deal of it comes from muscle information, doesn't it, when the muscle's active? So we're only getting a little bit of the picture through the tests that we can do for proprioception. Yep. But potentially you could go back and do those again.
Yeah, yep.
Okay. Was there anything else at all?
I think I just need to just personally get a bit more of a routine of whether I'm, if I'm testing the good side first, and then as opposed to, I don't know, sometimes I forget things, and I think I just need to have a bit more practice and experience in running through an assessment, really.
Okay. Yeah, I think you speak really confidently to the patient, and I think the patient probably felt that you knew what you were doing. Yeah. So that's fine.
Yeah, I think it's just so I can have it as a bit of a
smoother process. Yeah. Okay. All right. So what would be some treatment options for Barry?
Okay. So if we're looking at maybe some of the strength issues, if he's got if he's not activating some of his muscles more than others. Yeah. So we could do some sort of helping him activate the muscles. So we could do some things like we could even use electrical stimulation to do that. Have him sort of, I guess, weight bearing through the foot a bit more. So we could do some more exercises with him in standing and that kind of thing to sort of get the muscles working a bit more. Yep. In terms of muscle length, attributing to time and everything, we could do some stretching, to see if that helps with the length as well. And also maybe with if he is having problems with the proprioception, it could be a matter of some foot placement. But I think a lot of it's difficult to separate, and it might be a combination of things that we'd need to look at. So
how could you put all of those things into a bit of a combination then?
Well, I guess doing some more foot placement type exercises with him, so that way he's actually weight bearing through his foot. We might be able to activate some of the muscles that may not be activating as well as others.
Okay, how does weight bearing help with that?
I guess just putting the weight through is actually you're using the muscle a bit more, and depending on which activity it is, you might be able to strengthen the muscle.
Yeah, so you're stimulating some anti-gravity activity, aren't you?
Yeah.
If you get people weight bearing, then you're sending some information up the ascending tract, aren't you? So that you tend to get better output down the descending tract.
So I think by doing that, and also, I mean, in standing as well, if he's able to, I'm not sure, a stretch generally needs to be sustained to be of any use really, so that would either be on a wedge or something like that, so that may not be able to be involved in like a foot placement type activity.
Or you could consider longer term, like hours worth of stretching. How could you...
So splints, we could splint him while he's in his room.
Removable splints?
So
Would be an
the
option.
resting splints.
You can even make walking splints if you really...
So I don't know whether an AFO would be of any use to him, or if they've tried that at all. But it would stop the activity generally because it has limitations at the ankle joint.
It would be worth looking at it, wouldn't it? But if part of the problem is spasticity, it might not change anything.
Yep.
Yeah. What about getting your hands on and getting your hands on his foot while he's moving it? Would you do any kind of handling or your hands on to help place the foot?
I would do a bit of the hands-on stuff. I haven't had a lot of experience with it, so it'd be something that I'd like you to show me.
Yep, absolutely.
Some
that would
more
be fine.
things.
Yep.
I have seen that being done, and it seems to help them be really aware of where their foot is and the placement and what they need to do, and which hopefully would roll over during his walking and in his gait. So.
Yep. Okay, so we've covered length. Tone would be covered by the splinting, wouldn't it?
Yeah.
You think of something else you could do for tone if you had all the money in the world for spasticity?
Botox injections.
You could request Botox. Do you think there was enough there to...
I don't think, maybe not. No, I don't think there was.
Yeah. I think you're probably right about that.
Or whether it was specific enough to be able to sort of locate the exact...
Yeah, so you've got to have a big spasticity angle, don't you, to make Botox worthwhile?
Yep.
And you said it was just before neutral.
Just before
you didn't
neutral.
have a lot more range than that, so it's probably not.
Yeah.
But it's always good to keep in your mind.
Yep.